Training and Development Part 2. I assume you have idea about this topic, especially the meaning of training, meaning of development, the difference between training and development, the importance of training and development as HRM functions, and learning curve of different people in the society. Then training process. According to your degree requirements, here I mentioned 5 steps. Under the 5 steps, we already discussed first step, identifying training needs. After identifying training needs, then we have to do the other rest of 4 steps. Then the training and development is as an important topic. Then second part of this session lead to discuss several important factors regarding training process. These are the learning outcome of this session: understanding how to design a training program, understanding training method, and understand the training evaluation. Training process. The second step, establishing training objectives. What is the meaning of objective? What are the meaning of objectives? An objective is a statement of what is to be accomplished by implementing certain activities. Objective means a statement of what is to be accomplished. What are the level thing we need to achieve by implementing certain activity. Here the activity is training activity, training program. Then through the training program, what is the thing we expected? When we write the thing we expected from the training program, that is the objective. An objective clearly defines the outcome within a stated time frame. The important thing, the time frame, there is a time framework. Then within this time period, we achieved this outcome, such that any impartial observer could be certain whether it has been achieved. Then objective clearly define the outcome within a stated time frame. Then what is the training objective? Training objective, what the participant will be able to know, what the participant will be able to know, that is knowledge, will be able to do, skills, will be able to value, attitudes. After the completion of training program, then after we identify training needs, considering the training needs, then we have to develop statement. These are the things we are expected to achieve within this training program. These things may be broadly knowledge, skills, and attitude. This kind of knowledge we are expecting from this training program. This kind of skill we are expecting from this training program. This kind of attitude change we are expecting from this training program. That is the training objective. Then establishing training objective purpose. The purpose of training objectives. Training objectives provide direction to the training program. If we have objective of the training, then it is the direction of training program. Direction of the training program. Then second one, training objectives provide framework, the path within which learning activities take place. Then direction explain, the framework, guideline or code develop. The third one, training objectives provide criteria for evaluation the learning activity. Then considering learning objective, then we can check after the training program whether we are reached to that point or not. Therefore, developing training objectives are important. Then step 3, design training program. Designing training program. Then now we are analyzing the training needs of employee, then considering the training needs, we are developing training program objectives of the training program. Then the third step, we have to design the training program. This step covers content and context of training program. Content and context of training program. It includes training content. What are the things we are going to teach? Training material. What are the material we use? Training method. How to do the training program? Who are the trainers? Trainers. Then time duration. Whole program. The duration for whole program as well as the duration for each session. Place of the training program, whether workplace or outside the workplace. Workplace of the training program. Then training budget. What is the budget we have to do this training program? Training budget. Then these things are important when we are designing training program. Then first one, training content. Training content refer to all information which is aimed to teach knowledge, skills, and attitudes. What are the needed information, facts, and figures we have to deliver, we have to use during the training program to the trainees during the training program. Training content refer to the all information which is aimed to teach knowledge, skills, and attitude to the trainees during the training program. Then training content is to be incorporated with the training objective. Then training content should be designed considering the training objective. Then second one, training materials. During the training program, what are the things we use as a material? Considering training content, training materials are learning materials are to be prepared. Training material or learning material are to be prepared considering the training content. Then we can use several training material like slide presentation, videos we can use, chart and graphs we can use, games we can arrange, different activities we can arrange, then field work we can arrange, or sometimes some other activities like group work we can arrange as a teaching material. Then under the designing training program, we have to consider training materials. Then we have to consider about the trainers. Who is the trainer or who are the trainers? Then selecting an appropriate resource person. Important. Considering the whole training program and each session, we have to select appropriate trainers. Trainer may be within the organization, or trainer may be outside the organization to conduct the training program. The next one is training duration. What is the duration? Time framework. Then it may be sometime 1 year, 6 months, 3 months, 1 month, 2 weeks, 1 week, 2 days, 1 day. Training durations. Considering the content, availability of the trainers and the facilities, especially we have to consider the financial situation of the company, we can decide the duration of the training program. Considering the content, availability of trainers, facilities, company financial situation, duration of the training needs to be decided. Then training place. The training place is important. For example, we can do the training at the company premises, company boardroom. The company boardroom is common. It is familiar for all workers. It is inexpensive thing. If we have limited budget, then we can do the training program within the company. However, when we are selecting the training place out of the company, it may be a training center or the hotel or another open area or suitable area, then we have to pay. They need more money. But if we are selecting outside place, then trainees can enjoy the training program because new environment, new things, then they can enjoy the rest during the rest of time. Therefore, we have to decide whether we are doing within the company or outside the company or the suitable place. Considering the learning style of the participant, we have to decide the place of training program. The most important thing is the training method. Training method means the strategies used by the trainer to deliver the content of the training program. The strategies used by the trainers to deliver the content of the training program. There are different training methods. However, for your understanding, I selected here several training methods. Then first one, on-the-job training. On-the-job training is very effective training. I think this is the ideal training. On-the-job training means training is given by allowing the trainee to perform duties on the job. Then we allow trainee to do the activity of the job in the real working place. So doing the activities of the job, trainee learn the know-how of doing the job. This method is one of the best methods to train the trainees, and it has own disadvantage, like it is difficult to apply for certain job training. Then for the example, we assume we need to train a doctor. Then after the A level, we select the student. Then we decide to train the student in the hospital practices. What will be happen at the surgery? There is no any knowledge about the student. Therefore, he or she or they can't do the work properly. Therefore, on-the-job training is limited. Then before doctor going to do the operation, we have to train the doctors using different method, then I will explain some method, training, kind of training. In another sample, Airbus pilot, on-the-job training method is very dangerous. It is inapplicable. Then on-the-job training method can be used for several harmless jobs. For the example, training a person as a lecturer. For the example, demonstrator, tutor, or temporary lecturer. Then he or she come to the class and start to teaching. Then there is no harm if there is a wrong. Then through the session, worker learn how to do the job. Then the second one, job rotation. Then training is given by shifting the trainee from one job to another job periodically. For example, then the worker shift. Now worker work as a payroll officer. Then after 6 months, the worker shift to the safety officer. Then another 6 months, after another 6 months, then the worker shift to welfare as to the welfare officer. Now he doing the welfare officer's duties and responsibility. Another 6 months after, then transfer to the HR analyst. Another 6 months, then the worker shift to the personal relationship officer. Then again transfer to the payroll officer. Then within 2.5 years, worker know 5 jobs. Worker know how to do the 5 jobs. Payroll job, safety job, welfare job, HR analyst job, and personal relationship job. Then it is a way of developing human. Then through the job rotation, we can develop multi-skill worker. Multi-skill worker. method is vestibule training. Then this is a training method in which trainees learn on the actual or stimulated equipment they will use on the job. Then trainee can use actual or stimulated equipment, tools, machine they will use on the job. But the thing is, are trained off the job. The tools, equipment, working environment, everything are equal, but the train was done out of the job, of the job, perhaps in separate room, perhaps in separate room. Then in this training method, there is a separate section or the room or place we arrange installing the actual or equal equipment. Then we train the workers within that separate room. Then this is the off-the-job training method. Off-the-job training method. Then vestibule training is necessary when it is costly or dangerous to train employee on the job. For the example, training a doctor. Then you know the process at the beginning, during the university education, at the beginning, they start to cut the dead body. Then dead body, cutting the dead body is not harm because the man is dead. Then if there is an error of cutting, no harm because the body is dead, no reaction. Then after several years practicing cutting the body or any other related activities, then the medical student got big knowledge about the body, how to cut the body, how to heal the body. Then likewise, different things relating to medicine, they learn through the dead body. At the second, they participated for the operation. Then senior doctors do the operation, then new doctors observing or helping. Not directly they are going to do the operation. Then likewise here, the picture show training of the pilot. Then what will be happen when we introduce on-the-job training to the pilot as a training method for the pilot? It is dangerous thing. Therefore, we prepare a separate situation, separate section, separate place as a plane and the sky. Then we use in this place, we train how to start the plane, how to drive, how to fly, how to take off. Likewise, everything explained using a vestibule training.
Okay, we then come to init B. What triggers, James, the init B?
The load sheet.
The load sheet, good. So basically, once the load sheet is off, what it's...
That's your initial preliminary prep. And then you're into the panel scan phase. Then up, so we've done the electric panel up to next one, hydraulics panel. Again, just checking that all the lights are out, which they are. Yep.
So if you toggle up to get to where you'll see a flight discontinuity, that is where the end of the SID is at tower. So right. What we're going to do now is enter some waypoints. So this.
Oh, so we're now the end of the SID's here.
That's correct.
Here's the destination.
Yeah, so the next one anyway is going to be useful to have hard tune to departure to back up the SID.
We're doing 6 Delta, correct?
That's correct.
So the parking brakes on.
Below line checks complete.
And now we would tell ground crew our clearance to face
So the way you
west.
do that is using interphone. So you just flick to interphone.
Flight deck ground, permissions, ground, go ahead. Good morning, we've got permission start through to interface westward. Okay, can I have your parking brakes released please, all ground checks complete, area's clear, both engines are clear. And if you push back to face west, you can release the parking brake please. Parking brakes on.
So when you're ready to start engines, you'll start engine 2 first, but you'll talk to ground. So you just flick this one forwards and then say flight deck to ground, ready to start engine 2. Now just feel as though you're overshooting the turn slightly, just until that yellow line is sort of just behind your back. Now that's good, start your left turn. Keep the speed at about 7 or 8 knots for the turn. That's good. On the straight bits, you can accelerate up to 30 knots maximum. But for turning, we keep it at below 10, just a touch below 10. So, where you've got to on the checklist now, Ben, is where you'd be before calling for takeoff clearance. The one thing you're waiting for as well, if I call to mechanics, they're secure.
Easy 125, Alpha 1 ready.
Easy 125, you're clear takeoff, Bravo 06, surface wind 050, abort. Clear takeoff, easy 125.
Two flicks forward.
That's it, good.
Okay,
Hand off the thrust loop.
flex.
Yep, man flex.
SRS and one way.
That's it, good. So here comes 18 knots. Start slowly relaxing the side slit to neutral by 100 knots. That's it, good.
100 knots.
So check.
V1.
Pull back on the side stick about there, a little bit more. That's it. That's the correct rotation rate you're looking for. Keep pitching up and down, going steadily
Positive 5.
Here up.
Go for that horizontal flight rectifier. So eyes inside, keep pitching up, going up to about 15 degrees of pitch. Just tell you to come left a bit. Put that white box. Here's the middle of the flight rectors. To shoot for that box bubble in the middle. That yellow box. And James has made check. And then James will talk through the 100 scan. Let's leave one just for now. So you say to James, James, can you ask for a left turn heading 180 in 5 miles? And then he'll liaise with ATC for you.
Okay, James, to avoid this bad weather ahead, can we request a left turn heading 180?
Okay.
A few miles to
Scottish easy 125, got some weather ahead, about 3 miles, complete turn left heading 180. Easy 125, that is approved, and when clear of weather, route direct Dean's Cross. Left 180 for weather approved, when clear direct Dean's Cross, easy 125.
So this one, pull.
Yeah, full heading.
Left.
Yeah, just gently turn 180. So you want to miss the one on the left, but you definitely want to miss the one on the right. Red is a heavy return, so there's a pretty heavy shower in there. Once you're in the cruise, you're sort of monitoring the level off.
Easy 125, continue climb flight level 240. Continue climb flight level 240, easy 125.
It's green, yeah. Blue is on, green is active. Okay, so now let's scan through the ECAM pages. James will pull them up for you. Start with the engine page. You're just looking for any abnormalities, but if everything's green, it's looking good. So if you open up your range as well, so your ND shows you where the airport is, just to keep your spatial awareness.
And would is this the screen you'd be in on a normal?
I've returned to ARC now. This place, you just want to be able to keep key features in sight relative to the direction you're travelling. So now you can see the runway. That's a nice, that's quite a nice scale. Nice. You can see
centre line as well.
It's just the green.
the green dotted line is the extended centre line for the runway. Yeah, it's more fun.
18575, easy 125, that. Good evening, 125 is heading 330 degrees, 3005.
Easy 125, thank you. Maintain the radar heading. You have 22 track miles of touchdown, reducing it 180 knots.
Maintain the heading, and you speed 180 knots, easy 125.
To start further, you've got to ask for the flap first. So you ask for the flaps to
Space check.
and then go for the speed knob, pull it.
Easy 125, you're clear to land, surface wind 150 degrees, 3 knots.
Clear land,
Those ever so slight, a little bit of a high rate of descent going there.
100.
Okay, start flaring a little bit now. Raise the nose a little, that's it. 13, close the thrustings, hold that attitude, fly it down to the ground. So then it's stepping onto the ground. Hold that. Let the nose will come down, that's it. Take the reverses, select your reverse. Decel, good.
reverse green.
Good. You'll hear 70 knots in a minute. Come back to reverse idle, that'll be from James.
70 knots.
Come back to reverse idle, that's it. And then forward idle by about 20 knots, which I think you've already done.
Oh,
yeah,
okay,
that's it. And if you
When we have a new nurse that starts here at Christiana Care, they are given 10 hours in our simulation lab for some practical application of the content that they learn in nursing orientation. And so today we would like to show the practical application of content that we learn in the 4th day of nursing orientation on an alcohol withdrawal patient.
Here we have JB. He is a 40-year-old male admitted for alcohol abuse with a history of alcohol abuse and cirrhosis. His very worried mother is with him, but doesn't understand why he has such bad luck. In scenario number 1, you will find a checklist of tasks that you should accomplish within this simulation.
My name is Jenna. I'm going to be your nurse today.
My name's Megan. I'll also be taking care of you.
Okay.
Hi, are you Mrs. B?
I'm his mother, yes.
Hi. We're going to just take a listen at him, assess him, just see what's going on with him, and then if you have any questions, just let us know.
I just don't know why these things happen to him. He lost his job and his wife left, and now he's here. He just has such bad luck.
Okay, can you guys get me something to drink?
We're just going to assess you real quick, and then we'll go from there. We got to check your orders to see if you have anything ordered for you to drink or eat, okay? All right.
Can I get a beer?
You can't have a beer right now. Can you tell me your full name and date of birth?
J.B. October 1, 1969.
Okay. And do you know where you are right now?
Yeah, I'm at Christiana Hospital.
Okay, great. All right. So we're just going to assess you. Ask you some questions about your alcohol history, how many drinks you have on a daily basis. Okay?
How often do you have a drink containing alcohol? This could be beer, wine, or liquor.
Most days.
Most days? Okay. How often during the last year have you found that you weren't able to stop drinking once you started?
Well, I just drink till I'm not thirsty anymore.
Okay.
And going down the list and answering each question.
I think we did good because we were attentive to the patient and also the mother, but I think we could have done better in addressing his emotional needs and the mother's. But at that point in time, we were just focused on getting our assessment done initially.
I think you both did a really good job with your assessment of the patient and really getting an accurate CWAS score on the patient. One thing I did notice when assessing the patient, you want to make sure that you ask the questions in a way that the patient is going to understand. So terms like delirium tremens, a patient may not understand that. So you want to maybe just say, do you feel shaky?
Hard. How come the baby's not coming? This distressed woman in labor is actually Montefiore Health System obstetrician Dr. Dina Goffman conducting a mock emergency delivery training.
Call for help, please. Second attending, anesthesia, pediatrics.
It's just one part of a comprehensive Montefiore Einstein OBGYN training program that uses childbirth simulators to train its most experienced physicians down to Einstein third-year medical students before they start their clinical rotations.
Don't drop them, they're slippery.
It's amazing to think about being part of such a natural process of bringing life into the world. It's also scary thinking about hurting the baby and wanting to know you're doing it right so that you're guiding this process and only helping.
Our department became involved in simulation in obstetrics relatively early on in the field. Probably about 10 years ago, we started small with a simulator and started working with our attendings and residents on some obstetric skills and obstetrics emergencies. We've built the program gradually over time into a very robust, active simulation training program.
The Montefiore Einstein Department of Obstetrics and Gynecology and Women's Health is leading a program to train experienced physicians at Montefiore, as well as those in the Mount Sinai Health System and Maimonides Medical Center. They're all part of a multi-center collaborative risk management company that proactively works to improve patient outcomes.
Congratulations, here's your baby.
Independent medical centers working together might seem like an odd concept.
Keep it arched.
But it makes perfect sense to these providers.
Well, I think in general, unlike maybe any other competitive fields, medicine is promotion of health, and we teach each other, and it's all about the patient.
One pull is equal to 3 pushes. So one contraction, 3 pushes is 1 pull.
1 pull, right.
You don't see progress after 3 pulls, you abandon it.
One can always hone one's skills and get better. And in fact, if you really think about these emergencies, they don't happen daily. So with any surgical procedure that's not done daily, you need to keep your skills sharp.
This is not easy, guys.
There are many different care providers here with us today, and each of us has a slightly different bias, slightly different technique, and we learn from each other. The learning never stops.
This particular training is part of a research study that will measure the effectiveness of simulation training on the technical skills of physicians and improved health outcomes of mothers and babies. But the collaborative also conducts multidisciplinary training to improve communication among all members of the delivery team.
Okay, she's got no pressure, guys.
It can get very hectic. We have 2 patients, mother and baby, nurses, attending physicians, resident physicians, pediatricians, anesthesiologists, and we need everyone to be able to quickly communicate with each other.
Dr. Goffman, a former Einstein medical student, wondered if students could also benefit from this type of program. She conducted a randomized trial which showed that medical students exposed to simulation training improved in both confidence and participation in actual deliveries.
The next method is case study method. I think it is familiar to you. The case study is a method which provides descriptive situations. We give the details, stimulate trainees to make decisions. Basically, we use case study method to develop the trainees make decision-making skill. The purpose of case method is to make trainee apply what they know, develop new ideas to manage a situation or solve a problem. Then case study method, usually under the university education, we refer to train the student, case study method. Then outbound training. This is very famous training method nowadays. Many companies organize outbound training. I think you also already participated to a training outbound training, I don't know. Then outbound training is a technique used to enhance the efficiency of employee through experiential learning. Experiential learning. In other words, taking the group of employee away from actual work environment. We are usually conducting outbound training program from out of the work into the outdoor and are assigned some challenging tasks or activities. Under the outbound training method, we are giving challenging tasks, we are giving challenging activities that needed to be complete by them within a given time framework. Then within a time frame, we have to achieve challenging activities. We have to complete the activity which is challenging one. That is the outbound training. Then outbound training help in improve teamwork ability. Teamwork ability. Then here this picture illustrate teamwork activity, teamwork ability. Then leadership qualities we can develop through outbound training. When we are working, when we are completing a task as a group, automatically leadership, presenting a leadership by the several members of the team. Then help in resolving intergroup or personal conflict. At the beginning of the work, sometimes there may be a conflict, different purpose, different ideas, different plan, but finally they agree to a single proposal, then complete the task during the outbound training. This training method is important to develop the interpersonal relation, intergroup relationship, team building, especially. Then promote the interpersonal skill, develop the interpersonal and intergroup relationship, improve the communication skill. Then some outbound training directly you lead to develop the communication skill of the participant.
Jump out. Jump. Jump right. Jump out. Fantastic. Three, start. Are you ready? Fantastic. Now Good. Okay.
next training method is role play. Then role playing or learning through acting. Then role play means learning through acting. Is a techniques that require participants to perform a task in a realistic situation, simulating real life. Then sometimes we are giving certain role of the company, or sometimes we are giving certain situation to review. Then the training read the situation, understand the situation, then try to present. Then through the presentation, we can point out these are the errors, these are the bad behaviors, these are the good points, these are the development areas. Likewise, we can use. For the example, for your purpose, then you can do certain role play to identify your strength and weaknesses. For the example, when you are going to do a presentation or presenting something in front of your peers, then if you can video recording your presentation, then after the presentation, then when you watching the presentation, then you can identify certain errors, how your hand handles, move, what are the work you are usually tell. For example, some people use but. Then likewise, then sometime when right hand side moving, the left is silent. Left is moving, the right is silent. Or sometime insert in your pocket. Or sometimes you are using another thing in your fingers for the pen. Different malbehaviors we can identify through role play. This type of exercise is an effective means to take in and absorb the content and subsequences of new ideas. Role play. Step 4, implementation. After you design the training program, the duration, trainers, session, the content of the session, training method, training material, then you have to do the training program or carry out the training program. The carry out training program is known as step 4, implementation. Then the last step of training program. After the training program, you have to assess whether the training is effective one or not. Then training evaluation is important. Then training evaluation illustrates the effectiveness of training program or ineffectiveness of the training program. Then training evaluation refers to the process of collecting the outcome needed to determine if training is effective. Then there are different evaluation methods we can use to identify the effectiveness of the training program. Here I use 4 criteria to understand how to evaluate the training program. According to this one, then we can evaluate the effectiveness of the training program through learner's reaction, participant reaction of the participant. The second one, we can measure what was learned during the training. What are the concepts, what are the skills, what are the activities, what are the attitudes transferred from trainer to trainees. In third level, assess whether or not behavior has changed as a result of training. Then we can assess after the training program whether the trainees or the participants' behavior are changed or not. We can check. The last one, evaluate the impact of your program on business results. It is very difficult to quantify, but you can justify as a result of this training program or the series of training program, our business success are going high because of the training program.